Hi guys, it's Kirsty from In the Mess, and today we're going to be discussing alcohol withdrawal. So you're in the middle of a busy on-call shift. The nurse is called to say that they've got a patient who seems a bit distressed and they look a bit shaky. The nurse thinks that they're in alcohol withdrawal. But wait, what is that? And most importantly, how will you manage it? So let's go back to the start. It's very common for alcohol withdrawal to present within the first few days of a patient's admission. This will be in a patient who's acutely stopped drinking and has a background of alcohol excess. Typically, they'll be drinking about a litre of vodka per day, for an example. Symptoms can typically present within 8 hours of a patient's admissions, and the ones that we'll be looking for that are most common are tremor, anxiety, agitation, sweating, and palpitations. It's really important that we recognise these signs and we act on them promptly, because up to 1/3 of patients who do experience alcohol withdrawal can go on to have an alcohol withdrawal seizure, with this being a generalised tonic-clonic seizure. Alcohol withdrawal can lead to delirium tremens. Oh, I said it wrong again, didn't I?
Just do it again.
Delirium tremens. Why can't I say that word? Tremens. Is that right? Tremens. Tremens.
Like tremendous.
Tremendous, got you. What an absolute... I'm so dyslexic it hurts at times. Alcohol withdrawal can lead to delirium tremens, and this is a medical emergency that can occur within 24 hours to 72 hours of a patient's presentation. The signs and symptoms here differ from traditional alcohol withdrawal signs because it's also associated with hallucinations, delusions, and severe agitation. When it comes to treatment, initial management will be with benzodiazepines, and your own trust will have their protocol of which is their preference. These should be given regularly and also as required, but the most effective way of doing this is using a scoring chart. This is a really useful way of assessing a patient, as it gives us an objective way of seeing how their management is progressing and any further interventions that might be needed. Thiamine deficiency is also very common in people who are alcohol dependent. This is due to 1, their poor diet. They can also have gastritis that affects absorption. It's also the coenzyme that's used in alcohol metabolism. Deficiency can also lead to Wernicke's encephalopathy, which, if not treated, can lead to Korsakoff syndrome. Oral thiamine is poorly absorbed in dependent drinkers, and for this reason, we give them IV B-complex vitamins, which is known as Pabrinex. Early treatment can significantly reduce mortality, but bear in mind some of these patients may require ICU level care. Coming back to the patient, it's really important that you recognise their distress. I always try to help patients explain why they're experiencing these symptoms by explaining that alcohol binds receptors in our brain that like to be active, and over time they're dampened down. Our brains love activity, so it tries to up-regulate the number of receptors in our brain. When alcohol is acutely stopped, it means our brain becomes extremely active, and that puts them at real risk of having a seizure. The benzodiazepines help because they act on the same receptors, and it means that we can slowly wean them off over time, reducing their seizure risk. Effective communication with the patient and regular monitoring can lead to effective detoxification. In terms of follow-up, it's really important that we refer to our alcohol liaison nurses and substance misuse colleagues if deemed appropriate. It's really important to remember that if at any point you've got concerns for a patient, you can always discuss this with your registrar. It's important to bear in mind that while they are disruptive, they might need one-to-one management, and it's important that you discuss this with the nursing team. If you found this video useful, don't forget to like and subscribe to our channel, and that way you'll never be stuck on shift.